Hello, my name is Dr. Charles Durr, and I've been in practice here in Downingtown, Pennsylvania since 1999 with my partner, Dr. Joseph Childs. Now, if you're watching this video, you or a loved one most likely suffers from an irritable bowel condition or related digestive disorder. And so, many years ago, me and my partner started treating several conditions, namely fibromyalgia and a thyroid condition called Hashimoto's disease. And so, in treating those conditions, we found that there's several common denominators with people who have poor health. And as many philosophers, even Hippocrates says that look well to the gut for the cause and cure of most diseases. And so in practicing functional medicine, and particularly treating autoimmune conditions, there are certain priorities that you have to follow in order to get somebody well. In other words, if you don't treat the primary cause, secondary cause, and then the tertiary causes, you're not going to get the person well. And it just so happens that the primary priority in clinical chemistry and functional blood chemistry analysis is the gut. All right. And if somebody has a bad gut, you cannot fix any other condition because that leads to an autoimmune condition, inflammation, and any number of malabsorption or malnutrition. Right. So in order to fix somebody who has fibromyalgia or Hashimoto's or rheumatoid arthritis or peripheral neuropathy, we always had to start with the gut. And so I've never found a patient with an autoimmune condition who didn't have an irritable bowel or poor gut health in that regard. And so irritability or irritable bowel syndrome I use as more of a general term to describe many conditions of poor digestion. But it can range from any number of things that starts with food sensitivities, leads to malabsorption and malnutrition. It can also lead to bowel bacterial overgrowth, immune activation, meaning autoimmunity, yeast overgrowth, degradation of the intestinal lining, and what's called dysbiosis or abnormal flora, bad bugs over-dominating the good bugs. And so there are many mechanisms to irritability of the bowels or a digestive disorder, and diet being one of the primary ones. And so foods can be of utmost irritability. Gluten, dairy, soy, eggs, yeast. Most grains have the capacity to cause irritable bowel or degradation of the gut lining. Alcohol can do it, processed foods can do it, excess sugars, any number of things. And so what we call food-driven antigens are one of the primary causes of irritability. And if you're watching this video, chances are you've had some sort of testing or you've been to some sort of gastrointestinal doctor and you still don't have relief. That's why you're watching this video. And so what I'm here to tell you is that it goes well beyond just dietary triggers. And so you have to look at medications, and in particular corticosteroids, anti-inflammatories, antibiotics, and antacids are all known to cause breakdown and degradation of the gut lining and lead to irritable bowel syndrome. All right. So we'll get into that a little bit later. Infections can be a major trigger. One of the leading causes, or the common denominator from a microbial standpoint, is an H. pylori infection. And so many people have been checked for or know they do have an H. pylori infection. Many people are carrying it around here and don't even know about it. Chances are if you have a pet and you let them lick you, or if you clean their bowl, chances are you and the entire family might have some sort of H. pylori infection. And H. pylori, as well as Lyme disease bacteria, are what we call gram-negative bacteria, and they secrete what's called biofilm. And that can be a trigger in and of itself, and we'll get into that in a little bit later. So besides the infectious triggers, the medication side effects, and the dietary triggers, there also can be stress-related irritable bowel syndrome, particularly with the stress mechanism as it relates to cortisol, how it relates to a neurotransmitter called GABA, how it affects the middle brain stem called the mesencephalon, which then affects the vagus nerve. The vagus nerve is basically the governor of all the metabolic activity of the stomach, the peristalsis, secretions, enzymes, and so forth. And so if there's a disruption between the GABA, mesencephalon, vagal axis there, you'll have what's called a neurological or neurometabolic based irritability. Right, so that's something that needs to be investigated as well. There can be hormonal causes. Primarily, I find thyroid disorders can cause a condition called hypochlorhydria. Hypochlorhydria is a sign that you have lack of stomach acid in the gut. We're gonna get into that in just a moment. But the thyroid controls the rate of peristalsis, or the rate of digestion in the gut, which can be affected when there's a thyroid disorder, as well as progesterone, estradiol, testosterone, estrogen. Any number of hormonal imbalances can cause a problem. Brain trauma. Now, people frequently who've had concussion develop IBS shortly thereafter, and there's been laboratory studies where there was mechanically induced brain trauma to mice, and they started to show signs of leaky gut syndrome or intestinal permeability within hours of the brain trauma. So that can be an issue because of its effect on the brain chemistry and the brain motility as it relates to what's called the enteric nervous system, which is the nervous system that is inside or within the gut and controls the functions there. And then there can be metabolic causes, diabetes, what we call glycosylated end products, when you're burning sugar inefficiently. And if you have an autoimmune condition where your body's attacking the gut, i.e. Crohn's disease or similar type disorders. So those are just any number of the triggers. And what I found is most people just don't have one smoking gun. They have several dietary triggers, probably on a few medications that aren't helping. Chances are they may have some infection, neurological or stress-based imbalances, and metabolic thyroid type disorders as well. And so what my job is to do is to try and determine what all the triggers are, and what's the primary trigger, what's the secondary trigger, and what is the tertiary trigger, if there is one. And if you're not addressing all the triggers, you'll have incomplete resolution or an unsuccessful intervention in terms of trying to resolve the irritable bowel syndrome. Now, in my experience, bowel disorders start with signs. Right? The first sign is a condition called hypochlorhydria. Hypochlorhydria is a condition where you don't have enough stomach acid being produced to break your foods down properly. And if your gut is not moving the food fast enough, what happens is you get stasis of the digestive tract, and the food sits in the gut too long and starts to ferment, producing lactic acid. So you get symptoms of acid reflux when you have not enough acid. And so frequently, if somebody goes then to an antacid, it compounds the problem. So what happens is, when you don't have enough stomach acid, you don't break proteins down from their long chains of amino acids into what's called peptides and individual proteins or amino acids. And so when that occurs, your body can be stimulated to recognize that protein as a foreign invader. And so basically how your immune system works is it looks at abnormal proteins in the bloodstream. If there's an abnormal protein that doesn't match your proteins, then it's tagged with what's called an antibody, which signals an attack against that protein. Now, when you're starting to develop a hypochlorhydria, you'll notice certain things. You feel like your bowels don't empty completely. There may be undigested foods in your stool. You may feel belching and bloating and a sense of fullness at all times. You may get constipation or diarrhea. You may get a coating on your tongue. You may kind of feel full for hours after eating. All these are just some of the signs that you have what's called hypochlorhydria. So generally that's the first step into an irritable bowel type of condition. Now, if that condition worsens and the integrity of the gut lining is starting to break down, or what's called intestinal permeability, or commonly leaky gut syndrome, it may develop into increasing food reactions. So are you the person that your stomach is flat in the morning, and by the time you have had dinner, your belly's sticking out? Well, that's a sign that you're developing intestinal permeability or leaky gut syndrome. You're starting to notice a lot of aches and pains throughout the body. You get food reactions unpredictably, or you can't tell what food bothers you or not. All these are just a few of the signs that you're developing not just hypochlorhydria, a lack of stomach acid. Now you're developing breakdown, or what's called intestinal permeability, i.e. leaky gut syndrome. Right? Now, if it's progressed beyond that, and you're starting to get sensitivities to smells and chemicals and lotions and perfumes and metals and so forth, that's to a point where your immune system's been highly activated. Your defense systems your barrier systems are breaking down and you're becoming hypersensitized. And somebody who's progressed into some severe IBS generally has chemical sensitivities as well. So all of those are signs of you're starting to develop the syndrome that progresses into an irritable bowel type of situation. Now, to properly fix somebody with a digestive disorder, irritability, or malabsorption, or what have you, it requires proper testing. And so where the testing begins with is a very good routine blood panel. Now, practicing functional blood chemistry analysis, that means we're going to do a lot more tests than you normally see on your routine physical. You'd get 3 or 4 vials drawn, they do a few tests, and then it kind of hit the high points. Well, practicing functional blood chemistry analysis, we're doing many vials, and we're looking at many numbers, and we're using a different perspective called a functional range, which is the difference between the laboratory range where you get on your traditional blood work is the average of everybody, whereas what's called the functional range is the average of healthy people. So it can pick up warning signs before they become full-blown problems. So we start with a general blood panel that will show me the biggest areas of breakdown, whether it be gut, thyroid, liver, immune, adrenal, or a combination of the two. From there, I can zero in on some specialized testing that will tell me, okay, here is the problem, and here's how we're going to fix it. All right. So there's a laboratory in Arizona called Cyrex Labs, and they have several what we call arrays that will test for several things that help us diagnose and fix leaky gut syndrome. And so the first one that I commonly order, if not every time for somebody with irritable bowel, is called array number 2 from Cyrex Labs, their intestinal permeability panel. Now I'm going to show you this poster. All right. And so this poster is a schematic of the gut lining. All right. And so what we see here is what's called the tight junctions. All right. If these tight junctions are breaking down, you develop intercellular permeability. All right. If there's a breakdown inside the cell, then we call that intercellular or transcellular leakiness. And then if you have something called biofilm, that's something secreted by a gram-negative bacteria that I mentioned earlier. That will cause malabsorption, and it will cause these tight junctions not to break, but to become rubbery. All right. So Cyrex array number 2 tests for all 3 of them. So if we see something called actomyosin antibodies, that means you have internal cell breakdown. The cell structure within your gut lining is actually breaking down and entering the bloodstream, and you're developing antibodies. So if we see actomyosin, we have what's called transcellular leakiness. This is common in people who have Lyme disease. The Lyme bacteria like to burrow into the cell membrane, set up shop, and what's what we call bacterial translocation. And they actually use your cell as a house, and their excrements and their byproducts coming through. And we'll see actomyosin, which is your cytoskeleton, breaking down. So actomyosin antibodies means that you have a problem breaking down within the cell. Now, if we see zonulin and occludin antibodies, that indicates that you have the tight junction are breaking down, and food particles and antigens are getting through the cell. And then if we see lipopolysaccharide antibodies, that means you have biofilm. Biofilm is secreted, as I said, by gram-negative bacteria and parasites, certain type of parasites. And what biofilm is, it is their adaptation to protect them from our immune system. They can live with inside it, and they can be resistant to antibiotics and our own immune system, and they can hide in that matrix indefinitely, and quite often it will result in false negative testing, particularly in Lyme disease. I noticed somebody who has a lot of biofilm will have a lot of negative tests until the biofilm has started being removed, and then suddenly the immune system will activate against an existing Lyme. Now, H. pylori, which I mentioned earlier, which is one of the most common gut bugs that causes all sorts of malabsorption and irritable bowel type of situations, is also a lipopolysaccharide producer or a biofilm producer. And so the problem with biofilm is it makes the tight junctions rubbery. But when it gets into the bloodstream, it does the same thing to the blood-brain barrier. And so it creates a lot of brain inflammation. In fact, a lot of scientists are studying it to use as a delivery system for certain medications they're trying to get into the brain. But when you have permeability of the blood-brain barrier, you get brain inflammation, which creates a lot of neurological and neurotransmitter deficiencies. And so biofilm is one of the most underdiagnosed conditions that I see. And Cyrex Laboratory, as far as I know, is the only lab doing the intestinal permeability panel. It's a very unique panel. Now, traditionally, for many years, there's been a test called the lactulose mannitol test. And this is a test where you drink some big sugar molecule types of drink, and you urinate and you collect that. And if these certain lactulose mannitol molecules are found in the urine, that means that that molecule must have gotten through the digestive tract. Well, it's an antiquated test at best, and these new tests from Cyrex not only tell you if you have leaky gut, which type you have, and then how best to treat it, because each one of those intestinal permeability or intestinal breakdowns require a different treatment that takes a different amount of time and a different amount of protocol. So array number 2 from Cyrex is by far the most valuable test that I do in diagnosing digestive breakdown, irritable bowel syndrome. But then there has Cyrex array 3. All right, Cyrex number 3 is the gluten sensitivity panel. Now, I can't tell you how many times I've been told that I've been tested for gluten and I've come back negative. Well, there are 24 variations of a gluten protein that you can be sensitive to individually, and you'll still have a gluten sensitivity. Traditional gluten sensitivity testing tests for 2 of them: alpha-gliadin in an IgE reaction, or tissue transglutaminase in an IgE reaction. So there is gliadin, alpha-gliadin, there's transglutaminase in 4 or 5 different forms. So there's actually 23 permutations, not to mention gluten, wheat germ agglutinin, which is the bran. Right? Now, interestingly enough, I had a gastroenterologist. His name was Ron, and he didn't have irritable bowel syndrome. He came to me for a lot of inflammation and other spinal-related problems. But upon examination and blood work, it seemed like he was very inflamed. So I ran array number 2, 3, and what's called array number 4. Array number 4 is a multiple food sensitivity panel. And array number 4, he showed dairy sensitivity. But on his gluten sensitivity panel, he was negative except for one finding: wheat germ agglutinin. All right? So it was interesting. His wife encouraged him to switch to whole wheat, and after he did that, that's when his inflammation got really bad, because he has a sensitivity to the bran, the germ. And so many people who eat whole grains actually have more of an immunological reaction than they do just eating the internal, less of the whole grain type of food there. So once he went off of whole wheat and dairy, his inflammation went away and he felt a lot better. Right? So he's actually able to eat regular gluten, just had to stay away from the whole wheat. So category 3 is the gluten sensitivity panel. It has 24 permutations of the gluten molecule. That is the most definitive test for gluten sensitivity there is. Now, I don't always order the gluten sensitivity panel, because what I do in my traditional panel is I test for the least sensitive gluten test there is, and if you test positive for that, then there's no need to investigate further. However, what I do order is array number 4. Array number 4 is called the cross-reactive panel. And so there's a condition, there's a phenomenon called cross-reactivity. Cross-reactivity means that foods have a similar protein structure, so that when your immune system is compromised or lacks what's called differentiation, the protein can look similar enough in its DNA sequence. The amino acids are all, about 5 of them are similar. Your immune system thinks it's the same thing. And so gluten is cross-reactive to dairy, coffee, yeast. It's also milk chocolate and oats. All have a similar DNA structure. And so if you stop eating gluten, but you're eating a cross-reacting food, you will still have inflammation. You won't feel any better. And in fact, statistics show that only about 60% of people who go gluten-free actually feel better. Now, also on that array number 4, they have 20 foods that are commonly eaten in place of gluten. So, unfortunately, many people jump out of the gluten fire into the grain frying pan. I think I got that backwards. I eat rice, corn, millet, quinoa, oats, and about 20 other total grains. And so the problem with that is that if you're sensitive to the gluten-free grains as well as gluten, and you switch to those, you're still not going to feel better. Right? And the other condition is with grains they are very hard on the gut lining. They have what's called a lectin content. Lectins are in grains, and they're in certain beans and certain other vegetables. And lectins are the outer covering of a grain. Now, a grain is a seed, right? The seed is basically how the plant is going to reproduce. So the outer germ has certain enzyme inhibitors that protect it from digestion from birds, right? So birds were meant to eat grains, humans were not. And so our digestive tract is not sound enough to break down those grains. And so it can lead to a lot of intestinal permeability and so forth. And so the grain test on array number 4 will show us all the particular grains that you may be sensitive to. Right? And so if you're eating lectins that are activating your immune system and lectins are causing breakdown, then we have to remove those strategically. So array number 3 allows us to really customize your nutritional recommendations to allow you to eat certain foods without activating your immune system, and certain foods you should eliminate. And so it's more in-depth, more sensitive, and more accurate than traditional food sensitivity testing. So array 2, 3, and 4 from Cyrex are key to properly diagnosing and treating an irritable bowel or digestive disorder. Now, that's if we're dealing with a food-based IBS. So in my experience, foods can be a trigger, but sometimes I run across patients that have a neurotransmitter deficiency, and I mentioned a little bit about this earlier. And so there's no definitive testing for neurotransmitter deficiency. So we use what's called the neurotransmitter assessment form. Right? That neurotransmitter assessment form allows us to determine if there's a breakdown in one particular neurotransmitter or multiple neurotransmitters: GABA, acetylcholine, dopamine, serotonin. And what I've seen is a pattern of certain breakdowns of neurotransmitters with certain types of irritable bowel. And particularly the GABA deficiencies have shown a pattern as it affects the middle brainstem, the mesencephalon, and its effect on the vagus nerve, which then affects the function of the gut. And so a lot of times people with neurotransmitter or brain inflammation have biofilm, and that is the root cause. But if we support the neurotransmitter deficiency, the irritability can usually resolve rather quickly. And the neurotransmitter deficiency type of irritable bowel is the easiest to fix, whereas food sensitivities are usually take the longest, with the exception of certain infections that produce biofilm, H. pylori and Lyme. Right. So we see the food-based irritability IBS, we see the neurotransmitter deficiency IBS, and then we have the microbial-based IBS. And so we use a lab called Metametrics that does stool microbial ecology testing. And so they're going to test for the inventory of probiotic bacteria. Right. Now, people talk about probiotics, and everybody seems to understand that it's very important for your health. But one of the things that they do for us that is of most value, in addition to our, is they produce certain secretions that keep the pH proper in the gut. Right? So the gut is soothed by their byproducts of their metabolism. They break down our sugars for us, and they also inhibit other yeast and bad bacteria from growing. But the enzymes that produced are important for breakdown of cholesterol. They're important for maintaining a certain acidity. And so if we don't have enough healthy bacteria, it could be half the problem. So the stool microbial ecology test tests for the inventory of all known probiotics. But then they test for all pathogenic bacteria. So your H. pylori, your E. coli, your Clostridiums, all those are tested for in the same test as well. Right? And so we see that, we know that that's a major issue that's going to have to be dealt with. H. pylori can be particularly hard to treat, and studies show that it's only about 40% of the time are antibiotics effective. And so they can be quite resistant, either because they've been exposed to many antibiotics or they're encased in biofilm. So we'll see if you have a pathogenic bacteria. But also in the same test, they'll do a yeast evaluation. If there's any Saccharomyces or anything along those lines, that will be dealt with. And they also test for any parasites. And doing a DNA analysis on the stool microbial test allows them to identify very specifically what species of any microbe you might be dealing with. But another feature of that test is that they will culture any known microbe that they find in a petri dish, and then they will apply all known antibiotics, and they will apply all known botanicals treatments for those bugs to see what they're resistant to and what will be effective against them. And last but not least, this stool microbial ecology test will show if you have any drug-resistant genes. In other words, if you have certain antibiotics that won't work for you. And so this is just that test alone, in this feature of the test, is worth the weight of the test, or the cost of the test. Because if you ever, God forbid, need an antibiotic, you don't want to know which class of it is going to work for you. So proper diagnosis is the hallmark of treating IBS properly, whether it be identifying food-based antigens, whether it be bug-based antigens, whether it be neurotransmitter deficiency, whether it be metabolic deficiency in thyroid or stress-related with cortisol. All those things need to be addressed either through proper testing, proper consultation, or a combination of the both, I should say. But what all that leads to is a very specific regimen of nutritional restrictions and nutritional allowances. So we're going to say, you can eat, this is what you can eat, this is what you can't. We're going to do this for so long, 8 weeks, and then we're going to retest. Right? We're going to see the problem areas in the beginning, are they resolving? All right? Then, based on that, I will change up the dietary recommendations, add some foods strategically back, other foods will be phased out. Some nutritional supplements that we're recommending will be tailored to that particular phase of correction and so forth. And so what I find is that if there is gut repair, food antigens, bug antigens, and neurotransmitter deficiencies, a person's going to need 3 8-week cycles to get the problem under control. But if they only have one particular trigger, particularly neurotransmitter deficiency, it generally takes 8 weeks to get the problem under control. And sometimes if it's just a mild case of one and the other, it'll take 2. And so what I typically do is have an initial consultation. I have you fill out a lot of questionnaires, a lot of forms. We sit down and we talk and we discuss a lot of interactions and testing and all your history and so forth. And then I'll send you out for my initial panel. The initial panel will be broad-based and comprehensive, looking for the major areas breakdown. From there, I will zero in on the secondary testing, whether it be array 2, 3, and 4 from Cyrex, the stool microbial test, or any number of tests that I have at my disposal. From there, I will design a specific diet for you and some nutritional products to support your recovery, whatever the biggest priority at that time will be. And like I said, we go 8-week intervals to evaluate the effectiveness. So at 4 weeks, I have an intermediate consult to discuss progress, and then all of my patients get my email address to correspond on a daily, weekly basis. So you have access to me all during the process. And so the process unfolds in 8-week intervals with blood work at the end of each 8-week interval. And at that point, we mostly see we're going to get most irritability to come to as much resolution, if not complete resolution, at that point. From there, I give give my patients strategies to follow to maintain the improvements throughout the rest of their lifetime. So if you're interested in meeting with me, having a consultation, maybe an evaluation, feel free to use the number at the bottom of this page. Until then, I wish you luck. Bye-bye.